Hi, my name is Alexis Popa. I'm a dietetic intern at Kaiser University, and this video is for HUN 501, Therapeutic Nutrition. Today I will be completing a teaching simulation for a nutrition-focused physical exam on a mock patient. I will be using the terms nutrition-focused physical exam and nutrition-focused physical assessment interchangeably. A nutrition-focused physical exam is a diagnostic tool that allows registered dietitians to be able to better treat and better diagnose malnutrition in patients. It gives a more comprehensive understanding of how severe a patient's condition can be, and therefore provides better evidence to give to insurance companies for the purposes of billing and coding, as well as coverage. A nutrition-focused physical assessment can be seen by, obviously, physical signs, and they can be in the form of micronutrient deficiencies, protein losses, fat losses, and they can be visually seen by performing a physical assessment that allows the registered dietitian to see muscle losses, subcutaneous fat losses, obesity changes, edema, pigment discolorations, and all of these physical signs I will go more in detail in the actual assessment. Physical focused nutrition assessment is actually very critical in some cases. It's not always indicated on every patient. And in fact, it may be an improper use of a dietitian's time to complete it on every single patient. So instances where it would be indicated would be upon doing their initial assessment or their initial screening. You just visually observe various signs of malnutrition, such as seeing their clavicle, deep indentions, temples, excessive hair loss on their pillows. There are various things that you can just pinpoint just by looking at them and talking to them. It could be indicated by a patient having a low BMI. It could be indicated if the patient has severe wounds, pressure wounds. It could be indicated if a patient has some sort of malnutrition diagnosis, such as gastric bypass surgeries or pancreatitis. Often if they have a feeding tube, there might be an indication, just again depending on the patient's condition. And these are often things that you have to determine based on your own clinical judgment. It's not always black and white exactly when or when not to do it. And if you're questioning whether or not you should perform a physical assessment or not, then it would be beneficial to go ahead and do one just to ensure that malnutrition is not going missed in a patient. Okay, so we're going to go ahead and move on to the physical assessment. And so if you just give me just a second, we'll get started with that. This is patient X, and he has agreed to let me complete a nutrition-focused physical exam on him. So what we're going to be doing is starting from head and going all the way down to the legs, and we will be assessing every portion to determine the severity of malnutrition that he may or may not have. Okay, so what we're going to do is we're going to start with the hair. We're just going to kind of feel around a little bit, pull just gently, and look at the coloration, the texture, and we're also going to see if it comes out easily or not. And those are all indicators of malnutrition, but it could also be indications of aging as well. And so because of that reason, that's why we need to go ahead and complete the entire physical assessment in a patient instead of just looking at one or two places on the body. Okay, and then next we're going to move to the temples. What we're going to do is just feel along the sides of both sides, and what we're looking for is hollowing or scooping. And so in a severe malnourished patient, you'll see what looks like an ice cream scoop that was taken to the temple. And it'll be very, very rounded and indented, and that means there's like a lack of muscle and fat in that area. And then next we're going to look underneath the eye, and you're just going to pull on it just a little bit gently. I'm just going to feel underneath. What we're feeling for is the muscle and the tissue right under here, and see if it's still got that squishiness to it, or is it dark, discolored, and is there hollowing. And then along with that, we can look just below the brow line as well to look for that discoloration and that hollowing. And then we can look inside the eye, and what we're going to be looking for is spotted eyes, discolored eyes, and in general, just seeing if they can see at all. So you can look, and you can just kind of pull down a little bit on the bottom of the eyelid so you can see all around the pupil. And then next we're going to move to the buccal area. And what we're looking for there on both sides, we're looking for that squishy skin and the texture to be there to make sure that they still have the fat in the cheeks and the muscles. And then next we're going to be looking at the lips. We're going to be looking for cracked lips, dried lips, discolored, black and blue. Do they have abnormal bumps on them? So those will all be indicators. Some of them could just be simply dehydration or chapped lips. So you got to think about like what the weather is outside as well. Is that a contributing factor to it? And then next I'm going to have you just open your mouth real quick for me. Okay, so what we're doing is just looking all around at looking at all the teeth. Are they missing any teeth? Are any teeth broken? Are any teeth discolored and cavity filled? We're going to look for the mucus inside. Is there plenty of fluid in there? We're going to look at the back of the throat to see if there's bumps, dryness, flakiness, scaliness, and then we're going to look at the tongue for those same things. All right, and then next we're going to be looking at the neck. We're just going to feel down the neck here on either side, and we're feeling to make sure that they still have that muscle intact. Is the skin still squishy, got a little bit of fat in there, or can you simply just feel the bones? All right, and then next we're going to move to the clavicle. We're going to feel all across the clavicle and on both sides. For this whole assessment, it's really preferred to do both sides because one side versus the other could be different. For example, if a patient had broken an arm and needed surgery, they could have loss of muscle mass in that one side versus the other side. Okay, so we're going to feel down the clavicle. We're feeling to see if there is muscle and or fat on either side of it, or can you simply just feel the clavicle itself. And on men especially, it's not very prominent, and so we want to look, is this typically a thin male, or are they a larger person but the clavicle is protruding? That could be a sign of malnutrition. But if they are thinner, then you'll be able to feel it a little bit closer to the surface there. And then we're going to feel down the sternum. We're feeling for the exact same things to make sure that there's muscle and fat on either side there. Then we're going to go to the acromion. We're going to feel the deltoid to make sure that it's thick and full and that you can feel the muscle and the fat there. Make sure it's rounded and make sure there's no protruding bone. The bone, if they're severely malnourished, the body will be more of like a V shape and the bones will be sticking out on either side of the body. All right, and if I could have you stand up and just turn around a little bit. Okay, so next we're going to move to the back. And keep in mind, though, that if this were a real patient, it may not necessarily be appropriate to ask the patient to stand if they just recently had surgery, if they're very elderly and frail. There could be a number of reasons, so you just got to keep that in mind. In a real situation, this might go a little bit differently. And then there are some patients, too, who are simply just incredibly ticklish as well. So feeling around their midsection may not really be an appropriate portion. It may be better just to skip this part. Okay, so what we're gonna do is we're gonna feel the scapula. We're gonna feel all along it and all the way down through the spine. We're gonna see if we can feel the muscle and the fat on either side of it, or is it just the bone protruding here? And then we're gonna see if we can feel the separation between all of the bones of the spine to see if there's fat loss in between there. And then the next thing we're going to do is we're going to look at the ribs. We're going to feel to see if we can feel each single rib individually. Is there fat in between them? Is there muscle and fat coating the top of them? Are they sticking out farther than the tummy? And we're going to feel all the way across them. We're going to do this on both sides, the front, the back, the left, and the right. All right, and then the next part we're going to do, we're going to look at the iliac crest, and what we're looking for is we're looking on both sides, and we're going to see again, is there fat and is there muscle on top of that coating it. And in the front side, especially on thinner men, the bone will be sticking out a little bit more. It's more likely, so just keep that in mind. Different body types. Okay, and you can go ahead and have a seat. All right, and if I can just grab your hand real quick. Okay, so the next thing we're going to do is look underneath the tricep. What we're doing is we're looking for fat and muscle loss underneath the arm. And so we want to see if we are able to completely pinch the skin, and if so, are we able to feel our fingers from the other side? Are we able to separate the muscle from the fat and from the bone? Is there fullness there still, or is there none? And then next we're going to look at the hand. If I can have you make an okay sign. All right, so we're going to be looking at the interosseous muscles on the back side of the hand predominantly. We're going to see if there's still tendon and muscle there separating the bones, or can you just feel the bones only, and are there indentions and discolorations? And then we're going to look at this fat pad, and that's a pretty strong indication of malnutrition if there's a lack of fat on the inside of the thumb there. All right, you can put your hand down. And then along this whole process, what we're looking at is all of the skin in general, to see if there's any kind of bumps, discolorations, splotchiness, dry, scaly skin. Those can all be indications of various malnutritions. Okay, and then if I can have you put your foot on this stool. So the next thing, we're going to move down to the legs. And again, if a patient is very frail, this may not necessarily be something that you want them to do. And in a hospital setting especially, they might be in a recliner or in a bed, so it might be a little bit easier for them to lift their leg up, but it just, again, depends on the patient. So we want the foot to be flat if possible, because that'll flex the muscle just a little bit. So we'll be able to tell the difference between just the skin and the muscle there. And so we're going to feel up and down the calf. We're feeling to see if the muscle is remaining. Is there skin? Can we touch our fingers together because there's no muscle left? And then we want to see if is the bone just protruding again. And then next we're going to move up to the patella. We're going to look on either side of it, the top and the bottom as well. Are there bony prominences sticking out? Are there discolorations? Can you tell that there's muscle there? And in a severely malnourished patient, you can tell the difference between simply a thinner person versus somebody who's missing all of their muscle. And then the last part is we're going to look up here on the thigh. We're looking to see if there is muscle remaining, if there is any fat there, and again, is it just loose skin? Is the bone there? You can feel in a very malnourished person, you can feel the bone all the way up the thigh. And so that'll kind of complete the physical assessment. And again, you want to make sure that you're doing this on both sides of the patient, because either side of the body might be different depending on their medical history. Okay, Okay, so we are complete with the nutrition focused physical exam. However, I did not include the nails in my exam that I did. So while you're going through doing the arms and doing the hands, go ahead and take a peek at the nails, just to make sure that the coloration is correct, that they don't have excess white marks, the shape is correct as well, because that could also be indication of various micronutrient malnutritions. And then I do want to mention that the Academy has a nutrition-focused physical exam pocketbook guide, which breaks down every part of the physical exam, and then it says how it is possible to become malnourished in that area, and also indicates which micronutrients somebody would be deficient in if they had that issue going on. So for example, with the hair could indicate iron deficiency, folate deficiency. It could indicate protein calorie malnutrition. When you're feeling the neck, if like the thyroid is enlarged, that could indicate something like iodine deficiency. So every area of the body is going to have potentially different micronutrient deficiencies, and so that pocketbook guide is a great explanation, breaks down every part of the physical exam, and it allows for you to pinpoint exactly what the patient will need once diagnosed. Okay, well, thank you so much. And attached will be a link to the pocketbook guide if that is something that you're interested in. Thanks.